Hello, I'm Dr. Wong Hon Seng. I'm the consultant ophthalmologist and a specialist in medical retina and uveitis disease. First and foremost, I'd like to say thank you to 𝗖ırdokter.com for having me in this video. Now, a lot of people have asked me, what is a subspecialty in medical retina and uveitis all about? Basically, I subspecialize or have special interest in diseases that treat the retina, okay, which is the nerve layer inside the eyeball, okay, and generally the disease I treat does not need surgical intervention, so the patient does not need to go under the knife for surgery. Then at the same time, I also specifically look at disease that affect the blood vessels in the nerve. For example, in diabetic eye disease or hypertension causing damage to the retina, or stroke in the eye, or burst blood vessel inside the nerve in the retina. And other disease, for example, like age-related macular degeneration, whereby affect a lot of elderly patients, that is also one of my special interests. And I'm also treating a lot of patients with uveitis disease. So what is uveitis? Basically, uveitis is a disease that is caused by inflammation inside the eyeball. And this inflammation can be due to infection, and at the same time, it also can be due to a lot of autoimmune disorder. So what does that mean? Basically, it means that our immune system had become hypersensitive, and because of that, it had produced a lot of antibody that attack our own tissue. And in this case, it attacked the tissue inside our eyeball and thus causes a lot of damage. So my journey in treating eye diseases started way back more than 15 years ago. And I remember when I first being the junior trainee in becoming an eye specialist, I encountered a lot of patients with a lot of medical retina and uveitis disease, whereby during that time it can be very frustrating, all right, because during that time there's not a lot of effective medication. But however, time has changed. We fast forward 15 years later, actually there is a lot of different therapy, a lot of effective therapy that not only, all right, can stabilize the disease, but it also can improve the patient's vision. So nowadays, I offer a lot of injection, a lot of intravitreal injection of different therapy into the patient's eye to improve their condition. And at the same time, there's also a lot of different form of retinal laser whereby I can perform with the least complication in order to improve the patient's vision. So ultimately, the main satisfaction from my job is that I am trying to improve and preserve the patient's vision. And the biggest satisfaction in my job is when patients initially come and see me, they'll tell me that the features of my face, they're seeing very blurry. But after treatment, they can tell me, hey, Dr. Wong, I can see a white hair, all right, on your head. And that will be put a big smile on my face. Thank you. If you have any inquiry, please do visit 𝗖ırdokter.com.